In this video, we're going to be diving into ChatGPT Health so you're fully equipped to get the most out of it. We'll talk about what it is, what it isn't, and we'll go through a full setup, tips, and tricks. OpenAI says over 230 million people are already turning to ChatGPT every week for health questions. Now, they're betting you'll hand over all the keys to that fragmented data. ChatGPT Health wants to be the layer that connects everything, explains what it means, and helps you walk into that appointment with the right questions. So, what exactly is ChatGPT Health? Well, it's a dedicated space within ChatGPT completely separate from your regular conversations. When you open up a sidebar, you'll see health in its own section. And that separation is intentional. OpenAI has designed this as a siloed environment where your health data, your connected apps, your medical records, and your health-related memories all stay containerized. Information flows into health from your regular chats, so if you mentioned you're training for a marathon, health is going to know that context. But your health conversations don't leak out into your normal ChatGPT experience. You can connect data sources like Apple Health for sleep and activity, MyFitnessPal for nutrition, Peloton for workouts, and through a partnership with a company called BeWell, you can pull in your actual medical records from over 2.2 million US healthcare providers. But there's something you need to understand. ChatGPT Health is not a doctor. It's not emergency care. OpenAI's own terms of service explicitly state it is not intended for diagnosis or treatment of any health condition. If you're having chest pain, you better call 911. Don't open ChatGPT. What it is designed to do is help you prepare, help you understand, help you walk into that conversation with an actual clinician more informed than you would have been otherwise. The other big benefit is brainstorming. When you aren't feeling well, why you could be having recurring headaches, or even what supplements you should consider taking. Think of it as a research assistant for your own body, for your own data. One that can synthesize all that information across multiple sources and help you formulate better questions. All right, let's talk about how you actually get ChatGPT Health and where everything lives in the interface. The first thing you have to do is just Google ChatGPT Health and then click on the first link because you have to join the waitlist. Once you join the waitlist, for me, it took about 3 days before I got access. As soon as you get approved, you're going to get an email and it's going to show up in your sidebar. All you have to do is click Health here on the side and then it's going to take you to the dedicated interface. ChatGPT Health appears in its own dedicated section right on your sidebar, right alongside your regular conversations and any other projects or custom GPTs you may have. Everything we discuss stays here. It doesn't leak out to your regular chats. Your health memories, your connected data, your conversation history, all containerized from your regular ChatGPT usage. Now, let's talk about connecting data sources. The first thing we're going to do is hop into settings. So all we have to do is click here, go to settings, then go to apps, and now we're in the main app section. You'll see all your connected sources here. If you haven't added it yet, all you have to do is click add more to start the connection. The first thing you're going to want to do is add Apple Health, which is going to sync your sleep patterns, activity data, heart rate, and several other metrics your phone or watch may already be collecting. You can also use MyFitnessPal, which at this time, it can only suggest recipes or calorie targets. It does not sync data if you have a subscription. You can add a couple others like MyFitnessPal or Peloton, which operate in a similar fashion to MyFitnessPal. You can connect AllTrails if you're into hiking. You can even add Instacart, which lets ChatGPT build you a shoppable grocery list based on dietary recommendations. If you want to sync your medical records, all you have to do is click plus and then click on medical records. For medical records, OpenAI has partnered with a company called BeWell. They operate a health data network that connects to over 2.2 million healthcare providers and 320 health plans. When you authorize this connection, you're using the FHIR-based APIs, the same standard your healthcare providers use to exchange data with one another. You go through identity verification, consent management, the whole process. Keep in mind, your provider has to support this. The nice thing is, if you don't know, you can just enter your zip code and find supported providers in your area. If your provider isn't listed, you're either going to have to manually export your medical records, or you're going to have to switch to a provider that's on the list. Once your connections are established, you are ready to start having conversations grounded in your actual data. Not just hypotheticals, not generalized advice. Responses informed by your sleep from last night, your labs from last month, your diagnosis from last year. That's the setup. Now, let's talk about what you can actually do. Now that you're set up, let's break down how ChatGPT Health actually works. And I think the clearest way to understand this is as 3 distinct layers, each building on one before it. Layer 1 is conversation. Layer 2 is grounding. And layer 3 is tools. Let's walk through each. At its foundation, ChatGPT Health is still ChatGPT. You're having a conversation. You can ask it questions in plain English, get explanations, or even explore topics. There's nothing revolutionary here if you've used ChatGPT before, But the conversation layer in health comes with some important differences from regular chats. First, the model has been developed in what OpenAI calls a close collaboration with physicians. That doesn't mean it is a physician, but it does mean the responses are tuned for health contexts. The language is more careful. The disclaimers are more present. The model is less likely to give you a definitive statement and more likely to frame things and considerations for your discussion with your doctor. Second, you can set custom instructions specific to health. Maybe you want ChatGPT to stop mentioning certain sensitive topics. Maybe you have a specific condition you want it to always keep in mind. Maybe you prefer responses framed in a particular way. These instructions only apply to health conversations and do not affect the regular ChatGPT usage. Third, ChatGPT Health has its own separate memory. As you have conversations, health builds up context about you over time. Your fitness goals, your dietary restrictions, conditions you've mentioned, medications you're taking. This memory persists across all conversations, but it's firewalled from your regular ChatGPT memory. You can view it, edit it, delete specific items, or wipe all of it entirely. So that's layer 1, conversation. It's ChatGPT tuned for health with dedicated instructions and isolated memory. Layer 2 is where things get interesting. This is grounding, and it's the core value proposition of ChatGPT Health. When you connect your data sources, you're giving ChatGPT the ability to ground its responses in your actual information, not generic advice, not population averages, your data. Let me show you what this looks like in practice. Type in a prompt like this. How has my sleep been this week? When I asked ChatGPT about my sleep, ChatGPT Health isn't guessing, it's pulling from Apple Health. And you can see its responses here on the screen. See how this response includes specific numbers, specific dates? That is grounding. The model is working with real information, not hallucinating probable sounding statistics. Now let's try something more complex. Type in a prompt about your lab results. When I ask ChatGPT about my labs, ChatGPT Health can pull from my connected medical records or any files I've uploaded. It can see my actual values, compare them to reference ranges, and explain what the numbers mean. But here's where it gets really powerful. It can look at those labs in context of everything else it knows. Let's just say my cholesterol was up slightly. But Health also knows from my connected fitness data that I've been less active in the past 2 months. It knows from previous conversations outside of ChatGPT Health that I traveled extensively in November. It can help me surface those connections and help me spot patterns I may have missed from just staring at a PDF from my patient portal. That is grounding. Layer 2, your data informing every response. Layer 3 is tools. These are additional capabilities you can bring into health conversations beyond just chat. First is uploads. You can upload documents directly. Maybe you have a discharge summary from a hospital visit. Maybe your doctor gave you a printed handout about a procedure. Upload it and ChatGPT Health can read it, interpret it, and incorporate it into your conversation. This is especially useful for older medical records, documents from providers that's not in the BeWell network like mine, or health information in paper or PDF form that isn't flowing through an API. Second is voice. You can see the voice option right here. You can access it on mobile. You can speak to ChatGPT Health instead of typing. This may sound like a trivial use case, but think about it. You're at a pharmacy confused about a medication interaction. You're in a waiting room trying to formulate questions before your name gets called. You're at home with a sick kid, hands full, trying to figure out if you need urgent care. Voice makes health accessible in moments when typing isn't really practical. Third is search mode. For brainstorming questions, ChatGPT Health can go deeper. It can search medical literature, pull from peer-reviewed sources, and compile an even more comprehensive response than a standard chat would provide. If you're trying to understand treatment options, compare approaches, or dig into the evidence behind a recommendation, search mode gives you that depth. See how the search provided citations? That's search mode working, grounding the conversation not just in your data, but in the broader body of medical knowledge. All right, let's get practical. I'm going to walk you through 3 repeatable workflows you can actually use with ChatGPT Health today. These are copy and paste prompts you can take directly from this video and use yourself. I'll show you the prompt, explain why it works, and demonstrate one workflow end to end so you can see exactly what it looks like in practice. This is probably the single highest value use case for ChatGPT Health. Let's say you have a normal doctor's appointment coming up. Let's use chat to ask some discovery questions and provide a list of things to consider talking to our provider about. Here's a prompt. Let me break down why this prompt works. First, we're going to specify the specialty. A cardiologist appointment generates different questions than a primary care visit. The model needs to know that context. Second, you're explicitly invoking connected data. You're telling Health to ground its responses in your information, not just general advice. Third, you're asking for prioritization. You don't just want a list. You want the most important items first because you might run out of time. Fourth, you're naming 3 categories: changes, concerns, and proactive topics. This structure forces comprehensive coverage. Fifth, you're telling Health to first analyze your data, focus on things that look concerning, then ask you 10 discovery questions that, once answered, will generate a fantastic list to talk to your provider about. The output you'll get ranked as a list of questions, each tied to specific data points from your records or connected apps. You may see something like your HbA1c increased from 5.8 to 6.1 since your last visit. That's actionable. That's grounded. This is what ChatGPT Health is for. Next, let's use an example for labs. So you get your labs back, there's a PDF full of numbers, reference ranges, flags, some things marked with high or low. What does it actually mean? Here's a prompt. This prompt does several things. Plain language translation. You're explicitly asking it for accessible explanations, not just medical jargon. Next is contextualized abnormals. You're not just asking what's flagged, you're asking what it means and how worried you should be. Next is trend analysis. Single data points are less useful than patterns. If your cholesterol has been creeping up over the last 3 tests, that's more significant than one slightly elevated reading. Next is question generation. You're turning passive information consumption into an active preparation for a conversation with your doctor. See how that's different than just seeing a red flag on a PDF? You now understand the number, the context, and what to do with it. Next, let's try the MyFitnessPal integration. Make sure you connect to MyFitnessPal and then just enter in this prompt. Let's break this one down. Connected data invocation. You're pulling from your actual data. You're not just starting from scratch. Goal specifics. You need to tell me what you're optimizing for. Weight loss, blood sugar management, athletic performance. The plan changes dramatically based on the objectives. You're not asking for abstract advice. You want specific meals, specific portions, a shopping list you can actually use. Studies have shown that ChatGPT's nutritional advice generally aligns with clinical guidelines, with accuracy rates ranging from 55 to 100% depending on the condition. It's pretty solid for healthy eating advice. Where it struggles is complex cases with multiple coexisting conditions. If you have diabetes, and kidney disease, and hypertension, the dietary restrictions start conflicting, and AI doesn't always navigate those trade-offs well. For straightforward nutrition planning, this workflow is genuinely useful. For complex medical nutrition therapy, you still probably need to see a registered dietitian. Okay, let's wrap up with one full workflow, one action in, end to end. Okay, I'm in ChatGPT Health, I've uploaded my medical records, Apple Health is synced, and some previous conversations that have built up context. We're going to type in the appointment prep prompt. So what we're doing here is we're combining everything we've just talked about. We told it we have an appointment coming up with a provider. When that appointment is, we've connected our data, and we've given it a deliverable. That's the workflow. It's that easy. Prompt in, actionable output out, grounded in your data. Okay, let's bring it home with clear boundaries and a practical path forward. Now, I want to leave you with a mental model you can actually use when deciding whether and how to engage with ChatGPT Health. Let me reframe everything we've discussed into one clear statement. ChatGPT Health is an AI assistant for comprehension and preparation around your health. It sits between raw data, your records, your apps, your scattered information, and your clinician visit. Its job is to help you understand, organize, and prepare, not to diagnose, not to treat, and not just make decisions for you. Now, here's where you do not want to use ChatGPT Health. These boundaries are not suggestions. They are hard lines. Emergency symptoms. If you're having chest pain, difficulty breathing, signs of a stroke, severe allergic reaction, or any acute emergency, don't open the app. Call 911. You go to the emergency room. You get professional help immediately. Next is formal diagnosis. If you're using it to figure out why your fingernails are falling out, you've probably crossed the line. If you're using its output to define a definitive answer to what the heck's wrong with me, you're probably in dangerous territory. Next is final authority on medications or tests. ChatGPT can help you understand what a medication does, what side effects to watch for, what a test measures, why your doctor may have ordered that. That's comprehension support. It should never be the deciding authority on whether or not to take something, stop something, change a dose, or skip a test. Those decisions require clinical judgment about your specific situation, your specific history, and your specific risk factors. ChatGPT Health represents something real. Over 230 million people are already asking ChatGPT Health questions every week. 40 million every single day. People are using AI for health support whether the healthcare system is ready or not. OpenAI is trying to meet that demand with a more structured, more private, and more clinically informed experience rather than just a generic chat. They've invested in physician collaboration, evaluation framework, privacy architecture, and purpose-built features. Is it perfect? No. You need to go into it with open eyes. But is there value here? Yeah. For the right use cases, with right expectations, with proper verification, ChatGPT Health can help you show up to your healthcare encounters more informed, more organized, and more prepared than you would have been otherwise. That's not nothing. In a system where you get 15 minutes and your information is scattered across 5 different patient portals, that matters. Use it wisely. Verify everything. And remember that the goal isn't to replace your doctor. The goal is to make the time you have with your doctor count. Thanks for watching. If this was helpful, please consider subscribing. I do data-driven, non-hype AI education, no clickbait, no breathless enthusiasm, just practical information you can actually use. I'll see you in the next one.